It was Steve Jobs, the creator of Apple, who once said, "You can't connect the dots looking forward. You can only connect them looking backward." I think he stole that from Soren Kierkegaard, one of our great philosophers. And Soren Kierkegaard said it this way: life can only be understood backwards, but it must be lived forward. It's taken me about 8 years to really understand the so much more and to see it unfold, But if I trace the path from inception, we've all seen that movie Inception, and then go from inception all the way to manifestation. We've all seen that movie Manifestation. I'd have to take you back to 2001 and to one of the clients who touched me the most. I hope Claire is a nurse now. So Claire was a single mother, receiving social assistance and, in fact, quite psychologically disabled. And I worked in that time for a program called Families First, and this was in the region of Peel. And my job as a home visiting nurse at that time was to essentially go out and do case management, assess the client, offer them referrals to the appropriate services and resources and all of those sorts of things. And Cheryl was one of those moms who was grieving and had been grieving for a very long time. Almost 10 years earlier, she had lost twin premature girls. And when I spoke to her and when she spoke her story, I thought from the hearing of her story that had happened maybe a couple of months earlier, certainly not more than 6 months earlier. And it was only as the story unfolded, I realized, wow, she had been in grief for an extraordinary period of time. And not only that, she had a dissociative personality. She had anger outbursts. She certainly could not care for herself and just barely her children. She had an imagination that was delusional. And I tried everything to support her in becoming well. I sent her off to all the people that I thought could help her, and absolutely nothing changed. And it wasn't just her story, because there were so many other stories like that. And I think amongst the most impoverished amongst us, we will find the most debilitated, the people who haven't recovered from their trauma. And here I was in the field working amongst these individuals that were on the outside, on the margins, and certainly not getting the help that they should. And I began to ask a question. And the question I began to ask is, could I, as the nurse, have the impact, do the so much more that would actually end the traumatic responses, the dissociation, the narrative of victimhood, and all of those pieces? Could I, as the nurse, do this? And I had been on a journey from 2001, when I first started as a public health nurse, heading all the way up to my master's and my PhD. When I entered my PhD, it was with a desire to find that intervention. And when I finished my PhD, I was completely disappointed, because I felt that the thing I'd gone to do, I hadn't done. But as things unfolded in all the ways that they unfolded, I now realize that each stepping stone of my journey was just bringing me one step closer to where I am today. I would move through my own trauma recovery journey. And it was as I moved through that trauma recovery journey that I discovered what would become the Becoming Method. I discovered a forgiveness technique that would support resolution of trauma. But then I had to go into all of these different territories to explore what is, how different people are talking about the same thing, and then get a full holistic understanding of how we do trauma recovery and how we do it extremely well. So I've moved from asking a question to then going on an investigation through my master's and my PhD, through living the restorative process that I will now teach you, to then actually preparing nurses to take on a role that we have not quite imagined before. One of the things that I'm well aware of is this, that we started on the front lines in a very formal way. Florence Nightingale was the first to begin the formal structure of what we now notice as nursing. And yet it started in war. You know, the Crimean War, the front lines, nurses, they're taking care of soldiers and then wanting to ensure that we do them no harm as we take care of them. And then we venture now into a new place, the place of peace. Because as we heal an individual of their trauma, they will experience a peace that we call ineffable, indescribable. No words that can actually be put to it. There's a substance to peace that sometimes we can't put a word to. This is what I'm calling nurses into. I'm calling them to be peacemakers and peacebuilders. And part of the eventual evolution of this program that I'm introducing now will also evolve into peace building and peacekeeping. I've just started an article looking at the peacekeeper and the peace builder and the role that nurses will play in pre-conflict, conflict, and post-conflict zones. That manifestation is still coming, but nevertheless, I dream of it almost every day.